Overview of M2020, M2030. The two questions M2020 and M2030 discuss about an individual's current ability with intake of oral and injectable medications, respectively. These questions on medication intake address the patient's ability on medication intake, but not compliance or willingness. These questions take into consideration patient's physical, sensory, mental, or cognitive abilities, along with any environmental limitations, all influencing the patient's ability to perform the said task. These questions also consider caregiver dependency regarding oral and injectable medications intake. Please consider these factors while determining your responses to the upcoming two questions, M2020 and M2030. Limitations influencing patients' ability with oral and injectable medication intake. Physical limitations. Physical limitations can include hemiplegia involving the dominant hand, Parkinson's with bad tremor in the hands, or rheumatoid arthritis involving small joints of the hands limiting range of motion of the fingers, muscle weakness with poor grips, and so on, all of which pose a problem for the patient to open the medication containers and prepare the individual doses of oral medication, load the appropriate dose of injectable medication and administer safely, thus compromising an individual's ability on safe medication intake. Also, individuals with dysphagia, unsafe swallow, and history of aspiration also have compromised independence with safe oral medication intake. Cognitive limitations. Cognitive limitations such as memory loss, dementia, and impaired judgment compromise safety of the individual by impairing one's ability with intake of right medication in the right dose and time. Sensory limitations. Sensory limitations such as confusion and impaired vision also compromise the independence and ability of an individual regarding safe identification of an oral medication and the right dose, loading of proper dose on an injectable medication, and so on. Environmental limitations. Environmental limitations such as wheelchair-bound and bed-bound status can limit access of the affected individuals to the medication storage site, such as a cabinet or refrigerator, thus compromising their independence with medication intake. Caregiver dependency with medication administration. On every assessment, for both oral and injectable medications, elaborate regarding the reason for caregiver dependency, availability of capable caregiver, and willingness to offer the needed assistance. Evaluate if the caregiver dependency is temporary or permanent and the potential for patient improvement towards independence with safe medication administration. Add detail on this information on the comments section, which can help justify the services offered. Adjust nursing visit frequency accordingly and make therapy referrals as appropriate. If the dependency is temporary, incorporate appropriate measures on the plan of care to help promote patient independence on the task. If the dependency is permanent with little room for change, make sure there is a capable and willing caregiver to provide the assistance needed and focus on educating the caregiver. M2020. M2020 identifies the patient's ability to take all oral medications, both prescription and over-the-counter, safely and reliably on the day of assessment, which is 24 hours prior to the clinician visit time and including the visit time. This question rates a patient on the task of obtaining, preparing, and administering the correct dose of all the oral medications on recommended schedule. This question typically asks about patient's ability, but not compliance with the task or willingness to perform or even the actual performance of the task in practice at the patient's home. This question specifically refers to oral medications that are placed in the mouth and swallowed, with absorption happening in the gastrointestinal tract. medications taken via sublingual or buccal routes, though placed in the mouth, are not swallowed and not absorbed in the gastrointestinal tract. So, these medications are not considered on this question. Also, medications that are administered via G-tube are not considered either, as they are not orally swallowed. PRN oral medications that are not taken on the day of assessment will not count on this question. During the patient assessment and medication review with the patient, check for patient's knowledge on identifying the oral medication by name, dose, frequency of intake, and intended purpose of intake. Medications for patients living in some group homes, assisted living facilities, and memory care units are totally controlled by the nursing station in the facility. So, evaluation of these patients for ability to safely administer all oral medications can be difficult. As already mentioned, this question rates patients on their ability to safely administer all oral medications and not on how the medications are currently being administered in practice. So, rate these patients based on the assessment of patient's vision, motor strength, cognitive ability, and dexterity of hands and fingers. Choice 0 on M2020. Answer 0 on this question. If the patient is independently able to take all the oral medications in proper dosages at the correct times. Patients who are alert, oriented ×4, independent at obtaining the pillbox from the medication cabinet or other regular medication storage site, and able to read the name and dose of medication on the label, identify the medication, open the container, prepare individual dose, self-administer the dose at the right time, set up their weekly pillbox, fall into this group and can be rated 0. Watch for patient's ability to access the medication cabinet, obtain the medication, prepare and administer the recommended dose. Watch for any compromise of patient's motor and mental faculties that can contribute to patient impairment on this task that can fall into this group and rated 0. Choice 1 on M2020. Answer 1 on this question. If the patient is independently able to take all oral medications at the correct times, provided the caregiver prepares the individual doses or fills the pillbox timely or develops a drug diary or chart. Patients in this group can present with impairments such as inability to read the medication labels due to poor vision, inability to open the medication bottles, and inability to prepare individual doses due to poor hand control. Accommodations such as removing the child-proof lids for individuals with weakness and poor hand control, marking the pill containers in different easy identifiable bright colors for visually impaired, filling in a weekly pillbox can all help promoting patients' independence with medication intake. Patients in this group can be independent at timely administering the medications, once the medications are arranged in advance or other appropriate accommodations provided. Choice 2 on M2020. Answer 2 on this question. If the patient is able to take oral medications at the correct times, if given reminders by another person at the appropriate times. Just to specify, reminders provided only by another person are counted as assistance on this question. Patient setting up an alarm on the phone or watch for timely medication intake is still being independent. Also, patients needing reminder for even one medication, such as a new medication on the list or a medication taken as needed, would also qualify for the same answer of 2 on the task. In this case, patients are dependent on caregiver assistance for reminders on medication intake. Patients in this group can be very forgetful and need timely reminders by another person but have no compromise of motor faculties to be able to access the medication containers, read the labels, identify the medications, open the lids, prepare individual dose, and safely self-administer the medications. Educating and training these patients on measures such as creating a routine for medication intake, developing a drug chart, setting regular alarms on the phone or watch, keeping the medication containers in a safe place easy to spot, and posting a note at a spot patient frequents can all be accommodations that help promote independence with medication intake in this group of patients. Training the patient on filling a weekly pill organizer along with measures discussed above to offer reminders can help these patients improve independence with the task significantly. Choice 3 on M2020. Answer 3 on this question: if the patient is unable to take all oral medications unless administered by another person. Patients in this group do not possess the needed physical and/or cognitive abilities to be able to administer all the oral medications safely and reliably, as ordered, and are totally dependent on caregiver assistance for medication intake. Patients in this group can be severely confused or suffering from dementia, such as individuals with unresolving confusion for any reason or Alzheimer's, and are totally dependent on caregiver assistance for the task. Individuals who are unsafe with medication intake regardless of receiving any assistance from caregivers for weekly pillbox filling or reminders for medication intake would also be rated 3 on performance of this task. For example, patients with difficulty swallowing the pills and needing in-person caregiver supervision to prevent risk for aspiration. Also, patients needing caregiver assistance to access the medication cabinet or other regular medication storage site at every instance of medication administration would be rated 3 as well.